We've got another anonymous question. Somebody has asked, what can this do for organs? What research has been done into using it for cancer? You've mentioned, for example, ultrasound is different from shockwave, surely. Yeah, I think there's a mistake. I mean, ultrasound is a shockwave in the sense that it is vibration. It's not as powerful as shockwave, which is a metal ball bearing bouncing up and down in a tube.
I mean, if you look at, this is a slide here about laser versus ultrasound, and there is an overlap. You know, so if someone has ultrasound, there is an overlap in regards to the areas you could use it. But one area you definitely can't use ultrasound where you could use laser is over the rib cage and the abdominal area, which is what they were talking there. There is less research at this point in time about the effect on soft tissues apart from musculoskeletal tissues. But increasingly there is research looking at the effect on maybe perfusions of kidneys. In having gone and done surgery, they're using it on areas where they've done surgery, but the research is not at the same level as the musculoskeletal and pain levels, so it's still in a very early stage in regards of us to be able to make good conclusions.
So can I go back to the fibromyalgia patients? I mean, presumably we're just doing pain relief with fibromyalgia, is that right?
No, it's more than that. Sorry, I know I'm showing you quite a few slides here, but there is some really, really good research because looking at the effect on the metabolism of nerve cells.
Okay.
And therefore, in treating not just the local peripheral area of the nerve, but actually the central DNA, RNA, the heart and soul of that nerve cell projected out to your finger or your toe, you are able to change the metabolism of that and have a much greater effect on both peripheral neuropathies, but also the interaction of the nerves centrally.
Yes.
And there's a lot of good research showing the sprouting and the changes in dendritic interactions between nerves when you target the actual cell body itself.
Okay.
And so what we're looking at in the pain clinics, there's a guy called Dr. Logan, who's an anaesthetist up in Chester, and his pain clinic uses it, and they use it there on fibromyalgia and polyneuralgia patients. They're targeting predominantly the central nervous system. They're not doing too much on the peripheral side.
Have we got some published results from that? Or?
That paper I showed you there, which was of 70 females,
right,
was a double-blind crossover study, and it was targeting only females because all of them had it as a secondary side effect of chemotherapy or radiotherapy for ovarian or uterine cancer. So unfortunately, they developed the peripheral neuropathy because of the effect of the cancer cells, cancer treatments.
Okay, so there's some encouraging work
there
going
is,
on there.
Yeah.
A question from Ollie, a physio in Cornwall. It's about his specific equipment, I think. He has an MLS Class 4 laser.
Yep.
I was interested to hear of how it was used in Andy's case to target the lumbar discs, given the difficulty of accessing these as the spinous processes, transverse processes, obstruct the direct path to the disc. What position were you in for the treatment? Side lying, hip flexion?
For me, prone.
Prone?
Just straight prone.
Okay.
Yeah.
But bone is actually quite porous to laser. You know,
Really?
if you're using an 800, it's very porous.
Okay.
Much better than skin is actually quite hard to get through. Bone is easy.
That's amazing. And I've had a question sitting on my list here for some time, because earlier on you said that if you leave the laser there for long enough, it's going to go right through the tissue. And the question is, well, what's actually going to go through? We're going to get a light shining out the other side, or?
Well, you could detect it. I mean, we have. I mean, you can do a very easy trick with a 6-watt 800 beam, and with an infrared camera, you can pick it up straight away on the other side and see all your structures of your hand.
Really?
So that would almost happen instantaneously. But getting down to sort of 4, 5, 6 centimeters down to a back joint, you know, that does take a little longer.
Okay. I saw a lovely question here a moment ago. Right. Can lasers be used as deep as ponds for stimulation of perfusion of CNS tissue, for example, post-stroke?
That paper, which I have up at the moment on the slide there, is actually a study looking at as I said, bone is quite porous, and therefore the cranium actually it penetrates very easily. Right. And this is a study looking at which the knock-on effect is to look at strokes, and they looked at 4 different species of human, I think rabbit, dog, and mouse model, and in all cases it penetrated very deep into the brain. So I think there will be a new generation of research looking at the effect on strokes.
Mm-hmm. What were they looking to achieve in terms of strokes?
That's a good question, because you know there's 2 different areas. One's obviously the neurodegenerative group of brain problems, and then there's the acute brain damage. The acute brain damage, you've got to be a little bit more cautious because a lot of these lasers are improving perfusion. The last thing you want to do is cause even more hemorrhage into the brain structure. So the timing, I think, is critical of how they choose to use these and when they use the, there needs to be some stabilization.
But are they targeting clots? Are they
Well,
strokes?
no, they would be targeting the actual neural cells to stimulate that, but also, to try and reduce some of the inflammation in that area, which causes the secondary long-term side effects.
Right.
Yeah.
Okay, so the answer to the question is it does penetrate deeply, and there is some research.
And there is research, but it's still very early stages.
Okay.